was an attending when I was a fellow, and she was really the mark that I had to hit in order to be a good doctor. She beat me into the room every single time, but I really tried to do what I could to emulate how she practiced. So then she ended up kind of backing away from pediatric emergency medicine and going into, her love is like this concussion, and that's because her 4 kids play ice hockey. And so on any given day, she's either in Massachusetts or Canada or New York, and that's only with one of them. Where are the other 3? Her husband has the other one, and the other 2 she's not sure. So she started a clinic called Heads Up Pediatrics in Westchester, and then she's a part of all of this. She's part of the concussion program at NYU, and she's part of the Pelham Youth Ice Hockey Association. She helps keep all their kids kind of less loopy. So she's going to discuss with us how we're going to be able to take that knowledge and kind of use it here for our kids.
Thank you, Anne-Marie. So I just have a question for anybody. Anybody have a concussion? All right, so you in the back, how long ago was it?
Which one?
How many have you had? And how long did it take for you to get better?
I've had 1 diagnosis.
Okay. And what were you doing? How did you, tell us about it. How did you?
I was 15 years old playing basketball, and I was elbowed in the face, and then was unconscious and fell forward and again hit my head.
Yet you're here, and so you can do
I
it
barely
all.
even twitched.
Exactly. So just can you explain to the audience what symptoms you're feeling in the days afterwards and how long it took you to recover?
For me, it was mostly feeling tired, an occasional headache, and then kind of distracted.
Distracted. Did you have any visual issues in terms of blurriness or anything like that?
Not really.
And
I
this
feel
was-
nauseous, anything like that.
Okay. And how long did it take you to recover?
Exact time frame, I'm not sure, but somewhere within 2 weeks.
2 weeks. Okay. That's great. Thank you. And then the second one you said, or there was another one that was undiagnosed?
There's been several.
Several? And is it always the same symptoms every single time?
Because I was foolish enough to continue playing basketball, but kids who were much, much larger than that.
Yeah, exactly.
Yeah, all along the same spectrum.
All right. So wait, 3, 4, 5.
Probably another 2 or 3 though when undiagnosed.
Okay. And how do you think you're doing right now?
It might explain why there's so many difficulties with all the schedules.
But you're obviously very successful. You're bright. You're here. You're a resident, right?
Yes.
Yes. Yes. So you didn't do so badly, right?
I made it.
Anyone else? Actually, have I had someone else's voice?
Silverio,
I've had many also.
You had many? How many would you say, and how long did it take you?
About probably 4 or 5 of them. I played both hockey and lacrosse.
Uh-huh.
I was carried off the field once by my coach. Never went to the hospital, so never officially diagnosed, but definitely headaches, nausea,
Impaired
tiredness.
judgment.
Probably like
Did you ever did you go back to school? Let's put this is another question. So did you
definitely
go
went back to class.
and how did you feel in class?
It was tough. It was hard to concentrate. I had constant headaches.
Uh-huh. And think about what you are, because this was when you were a child. What about in this state, right? No?
During college.
During college, okay. So how long did it take you to recover?
Probably 3 or 4 weeks.
3 or 4 weeks. That's typical. By the last one or with the first couple?
Probably the first one was a little quicker, but by the last one, probably 3 or 4 weeks.
Okay. Now, knowing where we are at today in terms of the amount of electronics that we're using, all the digital equipment, the computers, the cell phones, do you think that you would have been able to handle that at that point back then? Like thinking about how much you use it now.
Maybe, I don't know.
Do you think it would have made a difference?
Maybe.
So that's what I'm going to talk about, how concussions are healing now that are different from when we were back then in this technological age. Because we're finding that kids are actually having much more problems. Like you guys got better on your own, right? Completely got better. Now we're finding that kids are actually having problems more, and a lot of it has to do with the environment that we live in this day and age. So who am I? She explained I'm a pediatric ER physician by training. So I've been at Cohen Children's Hospital for the last 20 years. What I focus on more recently, though, is concussion care. And as Amber mentioned, that I do have my own practice. But how I got involved was because my kids had concussions from playing ice hockey, and then their friends would have concussions. And as an ER doctor, you know all your friends and all your neighbors are going to ask you, okay, so what should I do about my kid, and what should I do about my kid? And since my kids also play ice hockey, we were very involved in the community, and they needed to start a concussion program just to become more aware. So what I did was I created a program with them, and what we had started to do was impact testing. And what's basically happened, and it's by default really, that I got into it, is that I was looking for a concussion doctor to take care of all the kids that were happening in my program, all the concussions that were happening. We get about a dozen a year. And I wanted someone to take care of them. I was an ER doc, what do I know, right? And I wanted someone to take care of them as well as I would my own child. And what I realized is that unless you live in Pittsburgh or CHOP, unless you go to Boston Children's, there is really not a lot of good quality advice out there. And that's kind of how I got involved in starting my own. All these things that were occurring and all these tests and knowledge that was happening at all these other places where they see 20,000, for example, University of Pittsburgh sees 20,000 concussions a year, they were doing there and I was not finding it here. And so that's kind of how I got involved. It was really by default for concussions. So what I do now also is I also do research, and I'm with the NYU Concussion Center. I'm involved in a couple of research projects, one I'll talk about, and it's on sideline testing. Another thing is a credentialed impact consultant. For any of those who don't know what impact is, it's a neurocognitive test, which we'll talk about, which a lot of the baseline information has come from, and about testing in the NFL and the NHL. But I'm now one of their site investigators for one of their research projects. So if anyone is between the ages of 31 to 40 or over 50, come see me afterwards, and you can get a gift card to Starbucks, and I can enroll you in my study. All you have to do is play games on an iPad. It takes less than 10 minutes. So I'm the only site investigator here in New York. There's other places that do it in Arizona, Arkansas, and then also I still work at LIJ, etc., in the urgent care center. So let's get going. And if you have any questions, please raise your hand. Also, if any of this is repetitive because you had it before, please let me know. I'll be happy to move on. So hopefully this will work. And no, it's not. Oh, wait. Is there volume on this?
Yeah.
So did everybody see? There may not be volume for this, but this did. Okay, so I can't. That's okay. It's okay. We don't for that one. Okay, so this is an incident that occurred in the World Cup 2 years ago, where the Uruguay player was hit. If you saw that, again, hit in the knee. Was hit in the head by that knee, and then he was out cold. So if this isn't a concussion, what is it? Okay. And so what happened with that is that the doctor pulled him off and actually called for a substitution. But the player insisted that he can still play, and they let him back in. Okay, and he continued to play the game, and then Uruguay ended up winning 2-1 afterwards. Well, unfortunately, this win-at-all-cost mentality still occurs today in youth sports and among coaches and parents. And I think we as physicians can do a better job at educating our parents and educating our patients so that they realize that this is not a smart move and that they can get much worse from that. So what I'm going to talk about today, you guys are all ER docs, well trained. I'm not going to talk about severe head injury, moderate brain injury, or when to CT a kid. So if you know anything about pediatric emergency medicine reports, there's a great article that just came out in February of 2016, and Embry will send it out to everybody on the diagnosis and management of pediatric concussion in the ED. So this is not what I'm going to talk about, but it gives a great summary of the PCARN and Chalice, those guidelines into when to CAT scan a kid. So if you're thinking about like, okay, I got a head injury kid, when do I need to CAT scan? Just refer to this. The unfortunate thing though about this article, and I read through it, just came out in February 2016, is that it specifically says, and which I was a little disappointed about, is that it does say, in terms of the diagnosis, there is currently no objective measure with which to make the diagnosis. I completely disagree with that. So it does have some of its limitations, and that's what I'm going to talk about that today. In the same month, which I was very fortunate to see, there was a commentary from the Society for the Academic Emergency Medicine, and it's time to change from a symptom-based concussion assessment to a structured physical exam. So this is now your objective measures. This is your physical diagnosis in terms of toolbox, in terms of how to diagnose a concussion. And if the only thing you learn from this lecture is how to diagnose a concussion with your 2 fingers, then I've done my job, okay? Because I think that's the most important thing, is that you can diagnose a concussion anywhere. If you're on the sidelines, if you're, hanging out with some friends playing basketball and you get kneed and someone falls over and he's dazed and confused, you can tell me yes you do or yes you don't. So that's another article, and it's a toolbox that goes all over the different physical exam points, which we'll talk about. So in terms of concussion, as I mentioned, I'm not talking about the high acuity ones. I'm only going to talk about, really, it's the triage 3s. It's not the emergency ones. And so if you can identify a concussion, you've done a hell better than most physicians and most ER docs. Up to 85% of concussions will go undiagnosed. And what we're doing with all these tests and these physical exams is we're picking up those undiagnosed concussions. And also keep in mind, 65% of the diagnosed concussions occur in children 5 to 18 years of age. So most of the concussions you're going to see are the kids, are the adolescents age group, especially with sports. So what you're also going to learn is how to manage them. What does rest mean? Acutely, because that's what you're going to tell them is you're going to rest your brain. But what does that mean? Rest it, sleep all day in a cocoon in a box for 2 days or not. And understand what best practice management is. Now, best practice management is different depending on what state you're in and what your resources are. So we're going to have to try to, considering this is Brooklyn, and your resources are limited, I'm going to hopefully give you some tips that you can tell your parents so that they don't have the major centers to go to, what to do. And recognize the need for appropriate follow-up. And think about, there's certain clinical predictors of prolonged recovery that you can identify in the ER to determine which kids are going to be at risk for prolonged recovery. And those are the kids that you should think about, okay, if you're not getting better in a couple of weeks, you should go to see somebody else. So what is a concussion? It's a trauma. It's not the kid walking around and has had a headache for a couple of days. There's got to be an incident, a direct blow to the head, face, neck, or body, which is an impulsive force that is transmitted to the head. And what happens is the brain is loose within the skull, relatively loose. And with that trauma, and I'll show you a couple of videos here, is that the brain rotates inside the skull, and the axon, as well, there's linear and rotational acceleration. And it rotates in the skull, and then those axons pull, stretch, and shear. And some of those axons break. And then it sets off a neurometabolic cascade, which causes your brain not to function, simply enough. But it's immediate, and it's a functional injury. So by definition, CTs and MRIs are going to be negative. So there's no reason at all to do a CAT scan or MRI or any sort of imaging. So if you can diagnose that concussion, those head injuries, those are the easiest, those are almost like the triage 4 goals. If you see a kid that's walking around and you can diagnose that as a concussion, you can send them out the door and say, with a good sense of security, that it's nothing more than that when we talk about that exam. And you can tell the family they don't need to get a CAT scan, and it's easier to get out of your ER. It's all about ease, right? Getting them out as quickly as possible. But just keep in mind, symptoms and signs may evolve over a number of minutes to hours, even days. So even if there was a potential injury 2 days later and they're coming in with symptoms now, that's still possible. So it's about how you're going to, also in terms of your discharge instructions, what are you going to tell that kid after they leave their ER if they look fine now? Okay, you're going to tell them to keep in mind what symptoms they may have. So it's a functional disturbance, as I said, rather than a structural injury, and it's complex. It's a great set of clinical symptoms that may or may not involve loss of consciousness. And it's self-resolved. These are transient. They get better. Some get better in 2 minutes. Some get better in 3 minutes, 3 days, a week, 2 months, 2 years. So this is Sidney Crosby. And there you can see him right right there, he's getting elbow right into the face. And this is what I was talking about with rotational acceleration. Many of these kids actually, it's especially with the hockey players. I see a lot of hockey players. So anybody play? Oh, you play hockey, yeah. So you'll probably understand this. But a lot of them, it's not just getting hit into the boards. Yes, that happens, but it's getting blindsided mid-ice, exactly as you've seen there. I had one kid actually show me a video of, because they tape their practices, and showed me the games, and showed me a very clip that looked as quick as that. And it doesn't look like anything, but him getting elbowed in the face, whips his head around, and that's that same thing. And what happens is the kids don't see it coming. It's that sucker punch. And time again, I've had kids say, I got blindsided mid-ice. I've heard that again. That happened to my daughter. One thing I did mention also is that not only do I have 4 kids that play ice hockey, they've had 10 concussions among them, between them. And it's about picking those, and he's shaking his head. I see him back there. It's like, what kind of mother are you? They're still playing ice hockey, yes. But it's about picking up those incidents, those dings that you had when you were younger that got better on its own. Those are actually concussions. Remember, those dings, those getting your balance, those are actually concussions. So when you count those, it adds up. 3, 4, 5, how many of this guy, gentleman in the back? It all adds up, okay? So far, we're up to 10, knock on wood. They're still playing ice hockey, and they're going to do well. So that's it about rotational acceleration. So why are kids different? What makes them different than adults? So part of it is biomechanics. If you think about an adult neck, and here you have a nice big football player with a thick, strong neck, versus a little guy who's got that tiny little neck, his head is disproportional to the rest of his body. And if you think of it like a bobblehead, this is my little bobblehead guy, who's shaking back and forth. If a football player with a strong neck gets hit, he's going to instinctively brace himself to the point where all that force is transmitted to his body and his head's not going to move. However, if you have that same amount of force, if you did that to a child who's got less of strength out of his neck, his head's going to wobble around. It's that bobblehead leg. So it takes less force to shake that head around, to move that brain and rotate that brain within that skull. Okay, and you put a helmet on that kid, even worse. Okay, so that's one piece of it. Another piece of the developing brain is that the brain is not fully matured until about 25 years of age. And so during this, which might explain some of those collegiate guys, right, having issues later on. But in the developing brain, there's much more brain water content. There's the cerebral blood volume is not matured enough. The myelination is not there. Their skull geometry, their elasticity. That's all related to maturation. And because the brain needs time and experience to mature, and and the axons don't have the myelination to insulate itself, they're more vulnerable to injury. Okay, so that's another piece of it. So that for again less force, they'll be more likely to injure their brain. And then the response to injury too. So brain injury, we know during infancy, if that occurs, the kids are more likely, before they've developed the skills, have worse outcomes later on down the line, as opposed to a child who sustained a brain injury later in adolescence, because those kids have actually developed skills that are in place and have not gotten those injured. Whereas if you were younger and those skills, like reading, writing, whatever, were not there beforehand, you're more likely to have issues later on down the line. So short term, so what is the issue with concussions? Of course, that all the parents freak out about. Like, what's the big deal? Like, you got better after 5 concussions, you're doing great, you got better. What's the big deal? Anybody?
Functional issue. Secondary syndrome that can happen, and then I think, just based on what we know about concussions now, chronic traumatic encephalopathy that can develop as an adult. So I think it's really.
So that's the fear. You're absolutely right. That's what the public sees. That's what they are so afraid about, and that's why you see a lot of families kids not playing football anymore. There's a decrease in kids playing football because of the fear. Okay, but let me give you the numbers in terms of second impact syndrome, and everyone knows about that, where you have severe cerebral edema, you get hit again, and then you die, essentially. That happens, it's so rare, you're more likely to get hit by lightning than you are to have that happen, okay? And then in terms of chronic traumatic encephalopathy, that's a diagnosis upon death. It's a pathological diagnosis. But keep in mind, the people that they found with CTE are boxers, or professional boxers, and yes, professional football players. So if you think about that, those people, like a football player, is probably exposed to 1,000 hits, and they've done this for high school, like high school collegians, 1,000 hits, not concussions, just 1,000 hits over one season, over a lifetime. These are not our kids. That's not you, that's not you. So that's what people fear, but that's not realistic. And then you could say, okay, so they're all gonna get better. Well, there is an issue. And part of the issue is that it's the risk for second injury in the first week or so. And what happens, we know that you're 3 to 4 times more likely to sustain another concussion within 7 to 10 days. Anybody know why? Clumsy. Yes, but why are you clumsy?
Like coordination, like balance.
Yeah, so exactly. So if you think about it, if you got a football thrown at you and you try to catch it and you have a concussion. So basically your senses are off, your balance is off, your vision is off, your thinking is off. Your brain has to be able to see that ball coming at you, gauge how far away it is, how fast it's coming, turn your head a little bit maybe to make sure that the guy that you're hearing, and if your hearing is intact, coming from behind you, is coming before you can catch that ball or get hit by that guy, as well as sustain your balance while you're on one foot. Your brain has to do all that, take all those measurements, all that information in your brain, process it within seconds, within half a second. So if your brain is not functioning efficiently, you're more likely to either get hit by that guy or hit by that ball in your face. I had a kid who, elite hockey player who sustained a concussion sledding, and was told that he can't go to recess to play in gym. And this is another reason what you're going to have to tell your kids. Your patients, no sports, no gym. So it was